Hi, I'm Tim Wiedrich, Section Chief of the North Dakota Department of Health Emergency Preparedness and Response Section. Thanks for attending this presentation on threat hazards identification. During our presentation, we'll be describing the process to identify risks that have been the greatest potential to do harm in our state. And we'll also be covering those major threats, and one in particular we'll be talking about today is winter weather. We'll have participants online through webcasting, video conferencing, and teleconferencing. To manage our time efficiently, we're going to be asking you to hold your questions until the question and answer portion of the program. Please keep your video conference muted until we actually arrive at the question and answer portion. If you're viewing by webcast, we'll be giving you a telephone number to call to ask your questions, and I'll give those instructions about the phone system at the appropriate time. If you're having any technical difficulties with either the video conference or the webcast, please call our help desk at 888-813-5344. That's 888-813-5344. Well, let's begin our program. Shyla Thorson is the director of the North Dakota Department of Health Hospital Preparedness Division. She'll be talking about the risk assessment process called THIRA. Shyla?
Thank you, Tim. As Tim said, I will be discussing the THIRA process, also known as the Threat and Hazard Identification Risk Assessment. The Threat and Hazard Identification Risk Assessment, THIRA, is a three-step risk assessment process that helps communities answer the following questions. Those questions, as you can see, are first of all, what threats and hazards can affect our community? If they occurred, what impacts would those threats and hazards have on our community? And based on those impacts, what capabilities should our community have? The THIRA helps North Dakota understand our state's risks and determine the level of capability needed in order to address those risks. The outputs that form this process lay the foundation for determining North Dakota's capability gaps as part of the Stakeholder Preparedness Review. THIRA helps us answer many questions, and we answer these questions together. What do we as a state need to prepare for? What level of capability, capacity do we need to be prepared? What are our current capabilities and capacities? What gaps exist between capability, capacity requirements and the capability, capacity developed? And how can we address our gaps as a state? What risk do we all have to accept? As a part of the THIRA process, we do an annual self-assessment of community capability levels based on capability targets identified on the 3-year portion of THIRA. This requirement for grant funding, but our state would do it even if it wasn't. North Dakota has adopted the National Preparedness Goal, also known as NPG, as our preparedness goal by Executive Order 2017-17. It is a critical component of the effort to bring the data-driven decision to making to our preparedness. A little more on the NPG. This is informed by the risks of specific threats and vulnerabilities, including regional variations. It defines what it means for the whole community to be prepared for all types of disasters and emergencies. And it addresses the 5 areas of prevention, protection, mitigation, response, and recovery. It emphasizes a whole community approach, which optimizes the use of available resources. And finally, it describes 32 core capabilities that will help us address our greatest risks. Now to discuss the actual THIRA process. The first step is to identify the threats and hazards of concern. You can see this on the blue chart. Based on a combination of past experience, forecasting, expert judgment, and other available resources, communities identify a list of threats and hazards of primary concern to the community. The next step is to give the threats and hazards context. The communities describe the threats and hazards of concern, showing how they might affect their community, or in North Dakota's case, our state. Third, they establish capability targets. This is where communities assess each threat and hazard in context to develop a specific capability target for each relevant core capability. The capability target defines success for the capability. Step 4 is to apply the results. Communities estimate the resources required per core capability to meet the capability targets for each threat and hazard. Communities also plan to deliver the targeted level of capability with either community assets or through mutual aid, identifying mitigation opportunities and driving preparedness activities. The THIRA process is designed to be useful to small communities as well as large geographic areas, such as FEMA regions. It's not intended to be difficult to accomplish. If you have a high-level modeling, you can use that to support the THIRA process. The modeling will result in a more precision throughout the process, but it's not necessary. Experience and subject matter expertise can be used as well. You know your communities and what may happen. Describe that in the THIRA process. This process is designed to be iterative. We expect that targets and resource requirements will be refined as we go throughout additional years of implementing the THIRA process, and as we better understand the core capabilities and gain additional perspectives from whole communities. The process will work best when we, the cities, counties, state, and FEMA regions work jointly.
All right.
Thank you, Tim.
Thanks, Shyla. Next, we're going to be visiting with Sean Johnson. Sean is a plans officer with the Division of Homeland Security in the North Dakota Department of Emergency Services. He'll be talking about the collaboration process that's done as part of the THIRA assessment and also cover the main risks that have been identified for our state. Sean?
Thank you, Tim. And good afternoon, everybody. It's a pleasure to be here. I'm glad to be here to talk a little bit about something pretty important called THIRA. Shyla did a wonderful job describing really a strategic approach to how THIRA is conducted in our whole community. That's something I do want to touch on, though, is as you can see through the process she described, we need a lot of good expertise, a lot of strong background to really get the results out of this that we need in order to make some critical decisions on what capacity we need to build together. That whole community is, of course, you have your public sector partners that are a part of that, but also equally important is our non-government organizations as well as the private sector and academia. So it is our intent and what we have been doing for the past several years since 2012 to bring that whole community together in a collaborative process, and I'm excited to work specifically with the public health community as part of that whole community to help us work together towards a THIRA that really helps us make some key decisions to take care of our people. We talked a little bit, if we could, about the, as was alluded to, about the risks that, oops, sorry about that, the top North Dakota risks. And there are 6 of them. This is kind of a compression of several more. But the key thing that we look at is all the things that could happen in North Dakota or have, and we examine them based on how likely they are to occur. And also, if they do occur, what are the consequences? How severe could those consequences be? By comparing those two sides to our each hazard or threat, we're able to come up with a priority. You see the priority list in front of you on your screen. You have, of course, cyber, and a lot of that is becoming, unfortunately, it's becoming more and more likely. But with that could come some dire consequences. We often associate it with stealing our money or whatever it may be, but also if a cyber threat were to get inside of our energy infrastructure, that could be a serious problem that we all have to deal with. Weather, we're really looking at summer, as well as winter, and we're going to talk some winter weather here coming up. I won't get into that, but a lot of that is driven by the fact that that is our most likely hazard category, if you will, even though the consequences aren't always as severe as some of the others you may see further on down the list. Fires, and that primarily we're talking about our wildfires out there. Last year was a horrible year for wildfires. This year we're a little better off, but it's every season, it's prevalent, and it's also one of our longest times of exposure to hazards and threats, simply because it starts early spring and it doesn't quit until late fall. Infectious disease, there's other people at this desk is better suited to talk through that than I am, but suffice to say it could be a widespread event, and the consequences of that could be much higher, even though the likelihood is not as, say, a winter storm is on an annual basis. I'll wrap up with hazmat. Of course, with our oil industry, we think a lot about that, but also our ag chemicals that are out there too. I can tell you that our agency addresses hazardous materials incidents of large and small almost on a daily basis. Most of them, thankfully, are small, but it is probably, I would say, up there as one of our most likely hazards that we are exposed to every day. The last one, thankfully, we haven't had really a lot to deal with in North Dakota. That's terrorism. But it's out there. It is something that can touch us even if it occurs in another place also. So having the capacity and the capability to address that is key, even if it's not necessarily occurred in our state. Overall, no matter what, Shyla talked about core capabilities and targets and building capacity. By looking at all these hazards and threats together and looking at it from a standpoint of what's the most concerning impacts that we have as a community, it won't really matter what happens. It is, are we positioned to do the good things that we need to do to take care of our people? Sheltering, for example, occurs in any of these hazard or threats. If we're able to address sheltering needs of our communities, we're able to basically take care of them regardless of why we're having to shelter folks in the first place. And with that, we're going to go to that top risk as far as likelihood here in a moment of weather, but I really have nothing else. Thank you, Tim.
All right, thanks, Sean. Joining us now is Ken Samosko. He's a meteorologist with the National Weather Service. Ken's going to be giving us an overview of the 2018-2019 North Dakota winter outlook. Ken?
Well, before we get into our presentation, I do want to spend just a few minutes to go over what the title reflects. We see winter outlook. And I know you know what that means already, but for this presentation, it will mean something just a little bit different. So in terms of the word winter, as meteorologists, we have something called the meteorological winter. And that begins on December 1st, covers the whole month of December, all of January, and all of February. So as a season, is a 3-month chunk. And then the reason we're looking at that is because we want to know on the annual temperature cycle, when are the 3 coldest months? And they are December, January, and February. Likewise, as we come out of February, we get into March 1st. That begins the spring months of March, April, and May. And then summer would be June, July, August, and then back to fall for September, October, and November. Now, the reason I bring this up is because if you look at your calendar, you'll notice that on December 21st, it'll probably say the first day of winter. But that is not based on the annual temperature cycle. That is based on the astronomical season. And so how do we come up with that? Well, that is based on the Earth's position, more respectively to the Earth's tilt, as we revolve around the sun. It just so happens that on December 21st, the Earth is tilted away from the sun. So that represents when the sun's elevation above the horizon is at its minimum. And for Bismarck, that's about 20 degrees above the horizon. You compare that with the summer, it's about 66 degrees. So that's why we generally have the very cold temperatures in December, January, and February. Okay, that clears up the temperature and the winter part. Now let's discuss the outlook part. Notice the title slide doesn't say a weather forecast, because there is a difference between a weather forecast and an outlook. The outlook is more tied to a climate situation, whereas a weather forecast is more of a short term. In fact, that's really the main difference between weather and climate. Weather is something that happens in the short term. It's really a measure of time difference. A good example is, what are we going to get today? The forecast might say a cloudy sky, temperature of 26 degrees, and snow. That is very discrete. It shows you exactly what we're going to have today, whereas an outlook is into the future, and that has to deal with climate. That's a long term. So we're not going to use specific terms. We'll probably use terms like, what are the odds favoring a few weeks to a few months from now? What is the overall trend going to be? So that's why this is called an outlook, because it's really a climate outlook. So what is driving the climate outlook for this particular winter season? Well, you probably heard of El Nino. And El Nino is popular because of all of our weather factors that can dictate what kind of winter season we're going to have. El Nino is really the only one that has predictability a few weeks to a month to even a few months in advance. In fact, it's been since June of 2018 that we've been looking at the effects of El Nino for this upcoming winter weather season, and we're in for a weak El Nino. Now, if you look, since 1950, we've had 25 El Ninos. And you might say, well, why just 1950? Because it's been since 1950 that we've had enough ocean temperature data to really relate the warming of the oceans to El Nino. El Ninos have been occurring for thousands and thousands of years before 1950, but that's when the data has started. Now, since 1950, we've had 12 weak El Ninos, and that's what we're going to focus on for this outlook in this presentation. So the foundation for this presentation and for our outlook in terms of where we're going to be for temperature, let's begin with our 30-year climatology. Now, it's 30 years because in statistics, generally you need 30 numbers to come up with a good average. So we have 30 years of data, and the graph or the picture on your left is the average high temperature for our winter season for Bismarck, December, January, and February. On the right-hand side is the average low temperature for Bismarck, December, January, and February. And the reason why it's 1981 to 2010, because that covers the 30-year period. Now, that 30-year period will change, because you might be asking yourself, why aren't we using 2015, 16, and 17? We will, but it will occur in the next 10 years. So it's a moving average. It's a 30-year moving average, which means when we complete the year 2020 and move into 2021, that 30-year period will actually advance up. It'll be from 1991 to 2020. And then once we complete another 10 years, when we get to 2030, it'll go from 2001 to 2030. So it's a 30-year moving average. And what do we notice? Well, on the left-hand side and the right-hand side, you notice the temperatures are ranked. Not necessarily just by the year, but by the temperatures. And so they're divided into thirds. And what we have are above normal temperatures for the first 10. That's the one third. And then the next range represents the 11th through the 20th rankings. That is the near normal range. And then we have the coldest period, the below normal range. And that's one thing I want to mention. We talked the difference between weather and outlook. In climate and for these outlooks, we're more concerned about temperature ranges and not specific temperatures themselves. So as we go ahead and take a look at the 3-month outlook, this is December, January, and February. And by the way, this graphic you can see on the bottom of your screen says the Climate Prediction Center. Those are the meteorologists out of Maryland that come up with this picture. And if you go to our website often, which we hope you do for your forecast, you will notice this quite often. Sometimes you'll see the 6 to 10 day outlook, you might see the 8 to 14 day outlook, or you may see the monthly or 3-month outlook like you're seeing now. And what you see is the above normal is being favored for much of the lower 48. Now, aside from that, if you just look at the big pie there where I have the above normal, near normal, and the below normal, you notice everything's at 33%. Because if we didn't have a climate signal, then we would say, as we look into the future, that on any given day in December, January, or February, we would say that the average temperature, whether it be the average or the high or low, has an equal probability of being in one of the three categories, either the above, near normal, or below normal range. But when meteorologists and climatologists look at El Nino and they see a climate signal, there's a shift in above normal temperatures. That means there's a favor. It looks like it's going to be more in the above normal range across much of the country. So as a result, we bring up another pie, and notice the above normal range now has went from 33% up to 48%. And what this represents really is a confidence level. When you look at these maps, you'll notice that the very darkest colors, the percentages go up, and the very darkest colors in the blue, the percentages go down, representing the very below normal. That represents the confidence that a forecaster has that the average temperature over that 3-month period will average in the above normal range. So notice in the Bismarck vicinity, that's the little asterisk in yellow, we went from 33% up to 48%. That's an increase of 16%. Now the rule is if you increase one category, you have to decrease the opposite category by the same amount because everything has to add up to 100%. So if we started with 33% and we added 16% to the above, that means we need to subtract 16% to the below normal. And when you do that and you do the averaging, it comes out to 19%. So one thing we like to do, since above normal is favored, we like to add the near normal percent and the above normal together. And when you do that, it comes out to 81%. For all practical purposes, let's just say there's an 80% chance or probability that our 3-month average temperature will be in the near normal to above normal range for Bismarck. And there's about a 20% probability that the temperatures will be below normal. Now, you can use this as a proxy for the entire state of North Dakota because El Nino is very broad, it's very large. So that's what we're doing here. Now on our next slide, let's go ahead and take a look at that. And what you notice is we still have the above, near normal, and below normal ranges broken down for you. And in the past, we've had weak El Ninos, we've had moderate El Ninos, and we have strong El Ninos. In fact, our latest strong El Nino was 2015-2016, and if you remember back to our winter season of December, January, and February, it was quite warm. In fact, average high temperatures were about 35 degrees, and overnight low temperatures were about 15 degrees, and that's what's circled up there. But we know for this particular winter season, we are not going to see a strong El Nino. So we have pretty high confidence that in the above normal range, we're not going to be in the upper part of that. So where will we be? Well, when you take a look at our 12-week El Ninos, we find that the temperatures generally range between 24 and 30 degrees for average daytime highs. Now, that's not to say that there aren't going to be times we're going to be below that range or above that range, but over that 3-month average, we expect high temperatures between 24 and 30, and overnight lows to range between 3 degrees and 8 degrees above zero. Now, let's take a look at the weak El Ninos in comparison to the 30-year climatology, which we just discussed. On the right-hand side, you can see the 30-year climatology from 1981 to 2010. And again, we just saw this where the temperatures would range between 24 and 30 degrees for normal daytime highs, overnight lows between 3 and 9. But when you look at the weak El Ninos, the 12-week El Ninos, we find that the ranges actually occurred from 14 to 30 degrees. And really the 14 was an outlier because with the average being around 25, most weak El Ninos saw average temperatures in that 3-month span between 22 and 28 degrees, so the average came out to be about 25. As far as the average low temperature in weak El Ninos, pretty much in the middle of the pack. The range was -4 below and 9 up to 9 above, so we had an average of about 3 degrees. But you can see how weak El Ninos compare with the 30-year climatology, and we are in the low end range of both the high temperature and the low temperature. In terms of precipitation, another graphic from the Climate Prediction Center, notice that most of the state, the western and portion of the central, is favored to be below normal. Where you don't see anything, in the eastern part of the state down in South Dakota, that is what we call equal chances. Now that doesn't mean that you're not going to have any precipitation. What that means is there's no strong climate signal to tilt us into one of the three categories, the below, near normal, or above. So the screaming message here is you should be prepared for anything to happen. But for right now, there's not a good message. However, we did do a local study here in Bismarck, and we found out some interesting things. So the next graphic shows you the number of days that in Bismarck for a 3-month period, our winter season, December, January, and February, and also for our yearly snowfall. How many days on average does Bismarck see greater or equal to 2 inches of snow at any one time? And then we said, well, how about greater or equal to 4 inches? And then we'll take a look at our total snowfall. So for the December, January, and February, this is just our normal climatology based on that 30-year period. We find that on average, almost 4 days in that 3-month period, Bismarck sees greater than equal to 2 inches. The range on that 30-year climatology went from 0 all the way up to 12 days. So you can see it's favoring the lower 1/3 of that. So that 12 days was kind of an outlier. If you look at our yearly snowfall, on average in Bismarck, we would expect around 7.3 days of receiving 2 inches or more, and the range was pretty large, 1 to 18 days. Now, if you compare that to just the weak El Niños, again, we had 12-week El Niños, we see that two things basically. Number one is for the winter season and also for the yearly average days, they're much lower. 2.5 days with a weak El Nino for greater or equal to 2 inches, and about 5 days for the yearly potential for the number of days of greater or equal to 2 inches. Also notice the ranges are smaller too, 0 to 6 days and 1 to 11 days. How about greater or equal to 4 inches? Well, the 30-year climatology would tell us about 1 day in a 3-month period do we see on average that we have a snow event with greater or equal to 4 inches. Over a year, it's about 3 days. For a weak El Nino, not much change, about 1 day and about 1.5 days, so lower for the yearly. But notice again the range for the weak El Ninos, a strong signal only between 0 and 2 days of all those events that we had, of the 12 events, and only 0 to 4 days for the yearly number of days of greater or equal to 4 inches. So again, we're seeing a decreasing trend in the number of days with weak El Ninos versus our 30-year average. And now look at our total snowfall for Bismarck. And again, you can use this proxy for Williston, Minot, Fargo, anywhere in North Dakota. Your totals may be different, but the trends would be the same. So for our total snowfall, the 30-year climatology, we see 26.3 inches for Bismarck in that 3-month period. And then for the yearly snowfall in Bismarck, it's 51.2 inches. Now you look at the 12-week El Ninos, and what do you see? Much lower, 21.6 inches for the 3-month period with a yearly snowfall of 37.0 inches. So we are fairly confident that the odds are going to favor not only the winter season, December, January, and February, but also our yearly snowfall to be below average for Bismarck and probably across the state. Now, as we look ahead, our 3-month outlook, as we get into March, April, May, or spring, the El Nino will still be around. It'll be weak, but it'll be waning towards the summer months. So the signal for above normal temperatures shifts further to the west. Across North Dakota, we are in the EC. That's the equal chances, meaning there's no good climate signal, even El Nino, that says we are going to be in the above, near normal, or below normal range. So be prepared for any one of those three categories to dominate. The 3 months precipitation, again, much of the same. There's not a strong climate signal that we're going to have above, near normal, or below, so we should be prepared for just about anything as we get into the spring and also into the summer. Well, we hope this provided you with useful information to help plan the winter season and also for 2019. If at any time you have any questions, call us at the Bismarck National Weather Service Forecast Office. We're there 24/7, 365 days of the year. Hopefully we can do more of these presentations for you in the future. Thank you very much for your time.
Well, thanks so much, Ken. Appreciate that. It's time now for the question and answer portion of our program. For those viewing by video conference, please make sure your microphones are muted in your individual conference rooms unless you're speaking. Now, if you're participating by webcast, please call our toll-free number at 866-888-3385. That's 866-888-3385. Please turn down the volume on your computer when you call by phone. Now, there are several webcast seconds behind the real-time audio that's happening here in the studio. So if you're calling in by phone, just make sure you're listening on the phone and not on the computer. Otherwise, it will get a little bit confusing for you. We'll be displaying the phone number to ask your questions periodically through the remainder of the program. Now, once you've dialed the phone number, an automatic attendant is going to be answering the call. Your phone number, once it's dialed, will be automatically muted as well, so that we won't be able to hear what's happening on your side of the phone. Please press star and then pound to ask your question. That's star and then pound. You'll be put into a queue if there are other callers ahead of you. When it's your turn, the automated attendant will tell you that your microphone is unmuted and you have the floor. Go ahead and ask your question then at that time. If you're waiting in queue and you want to withdraw your question, then just press star and pound once again. Well, let's go ahead now and start to see if we have any questions from our audience. I'm going to organize this kind of two different ways. One is that if you're viewing by webcast, or if you're on the phone currently and you have a question, then just press star and then pound. Get on the phone at the number that was previously given and that you'll see on the screen, and dial it up, press star and then pound. So webcast or on the phone, just do that at any time. If you're participating by video conference, I'm going to walk through the 8 major cities, the largest cities in the state, so that we kind of do this regionally, and wait until we're at your region. Now, if you're not sure which city you're closest to, it's not that critical. If you're between Fargo and Jamestown, you're not sure which one you're closest to, just pick one. So I'm going to go ahead and begin by seeing if there are any questions or comments in the Fargo area first, but if everybody can just take a few moments to think about whatever questions you might have. I'm going to lead off with a couple of questions first, though, while you're thinking about your questions. And let me start, Sean, with you. I know that there are a number of stakeholders that actually engage in the THIRA. Right now we're concentrating on the public health and the medical sector with this particular program, but can you talk a little bit about the kind of the range of folks that are engaged in the THIRA process?
Yes, I can, Tim, and thank you for the question and the opportunity. I think the best way to answer that is really go back to the 3 categories of hazards and threats we look at. No matter what we got, we're looking at either a natural hazard, a technological based hazard, or an adversarial based. So when you're looking at those natural hazards, we're really bringing in partners from, say, the National Weather Service, but also our Forest Service in the case of wildfires, because those are also natural hazards as well. When you cross over that technological side, that's where we really start to pick up not only our health partners, but also looking at the folks in the fire service, again, more on the urban oriented fire service. But also critical to that is our private sector partners. A lot of the issues that originate there, but they're also addressed there because of the capabilities to do cleanup, for example, are primarily in the private sector. When we're looking at the adversarial, we're really looking at first and foremost, and in front of the line is law enforcement, but they can't do it alone. So again, we look at that from a point of folks like law enforcement who try to stop it or counter the threat when it's active, but then there are always consequences thereafter. So that's when all the other partners got to come together across that whole community and really pull together. So that's, we look at it for how we'd have to deal with it on the response side in order to address not only response, but recovering as well as preventing and protecting and mitigating.
Great, thanks, Sean. So Ken, can you just give me a little bit of a stronger indication? We talked specifically about these weather triggering trends, and is that, give me an idea if you could, what kind of the range of how strong, or obviously we talked about them being weak, but is there situations where this becomes a lot stronger triggering event and would give a lot more definitive condition for a specific season? Does my question make sense, first of all?
Yes.
Okay.
Yes. Well, as mentioned, we're going to be in a weak El Nino, and in fact, the El Nino really is not in full swing yet. We look for an ocean response and then an atmospheric response. And so the ocean temperatures are where they need to be for right now. But the atmospheric response, we tend to look for showers and thunderstorms along the equator, expanding and then moving to the east across the Pacific. Because what that does, Tim, and to our viewers, is that alters the jet stream and will have an influence on our weather. So far, we haven't seen the thunderstorm activity, but we do expect that to pick up as we get into the this month of December, and then we'll enter a weak El Nino in January and February. So as far as signs of increasing the strength of El Nino, we can generally look at that pretty far in advance, and we're pretty confident that we will not be increasing the strength of this El Nino. And the way we look at that, we look at the sea surface temperature anomalies or departures from that 1981 to 2010 climatic norm. So if they average between 0.5 to 0.9 degrees, I'm going to say Celsius because that's what we look at. That is a weak El Nino. If they're between 1 and 1.4 degrees Celsius, above average, then that would be a moderate El Nino, and then 1.5 to 2 would be considered a strong El Nino. And the El Nino we had back in 2015, 16, and 16 and 17, that's when we had a very strong El Nino, and sea surface temperatures were up around 2.5 degrees Celsius. So in short, we're not expecting a moderate or a strong El Nino. It will stay weak for this upcoming winter season.
All right, thank you. Again, if you're viewing by webcast or by phone, please dial our phone number at 1-866-888-3385 to pose your question. Go ahead and do that now. We'll be coming to the video conference, folks, in just a few moments. But first, I do want to pose one last question before we go to the video conference, and that's for Shyla. Shyla, we mentioned that obviously the weather has probably the greatest frequency and are one of the most common things that we end up dealing with from a public health and medical standpoint in the emergency preparedness programs. Can you give me kind of an idea what types of activities are impacted and what our responses are typically surrounding weather emergencies for hospitals and long-term care facilities and so forth?
Sure, Tim. Those public health and hospitals, they need to be prepared regardless of what the outlook is for a lot of the time. Their basic facility, if they were to lose heat, lose power, temperature can drop very quickly if you lose natural gas. And so the facility should have a preparedness plan in place, especially in hospitals and nursing homes and areas where those vulnerable populations are, for how to handle that. One way they can do that is to work with our statewide team and to contact our facilities and check with us and HAN assets. That's what our FEP, our Public Health Emergency Preparedness, and HPP, we have through the state medical cash assets, generators that can assist those facilities if they don't have them in their own facility during a time of a disaster. So to keep that in mind if an event does occur. Also, in worst case scenario, know their evacuation procedures if they did need to evacuate their residents. So those are some of the top things that we are looking at.
And so typically we will attempt to what we call harden a facility if we lose heat or air conditioning in the summertime. Right now we're concentrating on heat. That we have portable assets that we can bring in and temporarily heat. By temporarily, I mean multiple months, up to multiple months, or it could be a short period of time as well. We will always attempt to avoid an evacuation if at all possible. So if we can harden the facility by bringing in external heaters and temporarily connect those to the facility, or air conditioners or generators, that will always be our first choice. But there are times when evacuation does in fact become necessary. Well, let's go now to the video conference sites. I do want to encourage anybody that is on webcast or on the phone to go ahead and hit star and then pound after dialing 866-888-3385. If you have a question, this is the time to pose that question. Let's check in with the Fargo area, and anybody that believes that they're closest to Fargo, go ahead and unmute your video conference sites in the Fargo area and pose your question. Any questions or comments in the Fargo area? Hearing none, we're going to go head over to the Jamestown area and find out if there's any questions or comments from the Jamestown area. And let's check in with Bismarck. Any questions or comments in the Bismarck area? Well, let's pause for a moment. I'm going to go back to Shyla and ask a question. During weather emergencies in the wintertime, I know that we've had situations where we've had extreme weather conditions that prevent normal traffic from moving. Can you talk a little bit about the assets that we have positioned around the state for response when these emergencies occur, and then a little bit about what steps we would end up taking for deployment of assets from the state medical cache from our Bismarck warehousing to get to the field?
Sure, Tim. So what Tim is discussing is we actually have trailers with assets placed in the different regions throughout the state that if we needed to deploy certain assets and we couldn't get to the facility, these assets could be taken from these trailers. In certain instances, if an item is needed for a state medical cache, we would then work with our partners at the Department of Transportation to clear the roads to get those assets to that particular facility in the event of, say, a snowstorm and the roads are blocked. We would make our best efforts to get that there as soon as possible.
So I'm reminded of the situation that happened with Winnipeg's explosion and fire, in which along the eastern border of North Dakota, along the Red River, we lost natural gas supplies. There were about 1,700 patients in nursing homes and hospitals that had natural gas heating sources as their primary source for heating those facilities. And of course, we had bitterly cold weather during that time. So it set up a situation where on top of that, we then ended up with no travel advised because of a severe winter storm. When those types of situations happen, it is necessary for us to, at times, punch through those types of situations where we're doing extraordinary events with snow plows, other types of assets from the rest of the state agencies and many times local agencies. And so, Sean, I'd like to turn to you and just talk a little bit about how that actually gets coordinated between local and state emergency management.
Okay, thank you, Tim. And really, that's the biggest role of emergency management is to really help collaborate together with that whole community, including our state partners, and support ultimately everything that we do at the state supports local capabilities and local response. So we do that through using a system called the Incident Command System, which you've probably heard of yourselves out there in the public health world. You use it as well. And with that, we set up a ICS structure, just like we would for a flood or a protest. We had a big one then, or big structure then as well. And really, as far as the state unified command, we go on a unified command basis. Works is primarily we're going to be responding to those local requests. The example that Tim gave was while they had direct communications with your nursing homes and everybody out there, our local emergency management partners had a vested interest in what was happening there because they often would have to coordinate a local response in support of those hospitals. Thus, it was our kind of our role to help collaborate and coordinate not only with health, but also bringing in the DOT that was mentioned. Highway Patrol is critical to that. If you would have had to punch through, as you talked about, the Highway Patrol would be a piece of that, and potentially our National Guard, which is a huge toolbox that we have in the state on top of for their federal mission, their state mission. They bring a lot of capability, and they would be vital to such thing. That falls on us, though, to coordinate that and collaborate and make sure we're all kind of heading the right direction together as a team.
Yeah, I'm reminded that as you're mentioning that in that event that I was just speaking about, we were utilizing the National Guard to bring assets from our warehousing to the Red River region. We were 1 hour away from a deadline we had set to begin that process when the gas was actually restored, and so we were thankful for that. Let me head back to Bismarck, see if there are any questions or comments coming from the Bismarck area. and anybody from either the Fargo or Jamestown areas can go ahead and chime in. If you're on by phone, please call 866-888-3385 and hit star and then pound to pose your question. Any comments or questions from the Bismarck area? We'll go to Dickinson next. Any comments or questions from there? We'll be up to Williston now. Comments or questions? Moving over to Minot. Devil's Lake. So Ken, can you talk a little bit about the products that are developed by the Weather Service? I know that on a daily basis there's a lot of work that happens, and clearly when we have some form of emergency, not just our department here at the State Health Department, with local agencies, we're relying heavily on the products that you're producing. We have a lot of interaction, but I'm wondering if you can talk a little bit more about the types of products that are being developed that may be useful beyond what the communications that we would normally be doing.
Right. Well, what we use is we look at a lot of forecast models. That's one thing that we do. But we also look at our what we call grids, where we actually populate these weather grids that are spaced about 2.5 miles to 3 miles apart with weather data. And we look at that and come up with a forecast, a general forecast. And then we write about it with something called an area forecast discussion, with something that Sean may read or the public can read. Anybody can read it. And it'll give basically the overall pattern and what the gridded forecast is looking at, what we think is going to happen, because you don't want to follow a model, because the model is never correct. But at least you look for the trends. You look for the trends of the model. So we develop several products. We have, you go to our webpage and you can look at what we call the zone forecast package, which generally looks at every city. We have a point and click, which you can actually use your mouse and click on Williston, or you can click on Tioga or Stanley and get an actual forecast based on that gridding space just for that particular city. And you'll get the percentage of precipitation, the high temperature, low temperature. We also produce a state forecast product, which is read by many radio stations and used by the hospitals and also by Sean. So there's just a plethora of products that we do on a daily basis, and most of it will be on our webpage.
Sure, and a very important core component of what we end up doing on both on a daily basis, but also in terms of emergency and disaster response. Well, we left off with Devil's Lake. Let's check now in with Grand Forks and see if we have any questions or comments from that area. All right, well, I think that's going to draw us to the conclusion of the information that we had for you today. We hope that you found the information in this program beneficial and that you join us for future programs. This program is going to be available for viewing on demand within 24 hours of the original broadcast. Now, you can find it on our website at ndhealth.gov/ET. That's ndhealth.gov/ET. Just take a look for the category that's marked webcasts and training, and you'll find a complete set of archives there. Thank you so much for joining us.